My purpose for this talk is twofold today. My first target, there we may have some people in here who are family members directly impacted by substance use, whether you have a loved one who's currently in treatment or addressing substance use issue in any form or fashion. You are my first priority for this presentation today. I want to be able to offer you something that might help you in your support of your loved one. Now, the reason that I'm saying that as emphatically as I am, because this presentation today is a little different. Usually that's all I'm doing is presenting directly to family members. For this particular topic today, I've invited professionals to come to this presentation also. My second objective for this, and to be honest, I'm going to be sort of threading a needle and walking a delicate balance between talking to family members, but also talking to treatment professionals, because when I'm usually presenting to families, I'm giving you a direct topic, educational thing on something that you can take and apply that's going to be helpful, one specific topic that's related to your support of a loved one. But today, I'm sort of talking a little bit more about sort of zooming out and talking about the principles of effective family support and treatment. I am a big advocate in the belief that family involvement in treatment can have a huge impact on treatment outcomes. And I'm going to say maybe a couple of times here, if we're being honest here, because again, I'm going to talk to the professional community here about ways that we might improve family engagement. Because one of the problems that we have in treatment is there are a lot of barriers to including families in the way that I'm aware can have big impacts. Or the other side of the coin is to prevent important things from falling through the cracks, which, again, if we're being honest here, my experience is it happens a lot. And I've been developing, I'll tell you my background here in a second, but for the last number of years, I've been working specifically with families and with treatment programs in terms of coming up with strategies for delivering material that's going to help families, and as well as just the way that how do we overcome some of the logistical problems of including families in treatment. So again, my second target here is for professionals. My hope is that you're here with an open mind, with an interest in what can we be doing to continually better or raise the bar for our support and efforts in including families in treatment. And so, like I say, I'm going to be talking primarily to families. You're my number one. I want to be able to give you things here today, that tangible things that you can leave here with some suggestions, some strategies for things that you can begin doing right away, things that are totally within your control that can help and add to, contribute to the chances of a successful treatment experience for your loved one. For professionals, I'm going to be sharing stuff of ways that I work with treatment centers and just giving examples of the ways that I'm providing resources for treatment centers that overcome some of those barriers. So to begin with, I will try to change my slide. My slide isn't changing. Sorry about that. So, okay, formal introduction. If we haven't had the pleasure of meeting yet, my name is Jim Savage. I'm a licensed drug and alcohol counselor. I've been working in the addiction treatment field for, this is getting old now, close to 40 years. I started my career in the mid-'80s. A couple of years I had to take off there because I as I said, went to treatment after I relapsed, having begun working in the field, took a couple years off, so I'm never quite sure how to say how long I've been working in the field. But over 30 years, I've been working in addiction treatment. One of the most significant periods of my career, I ran my own adolescent outpatient treatment program for over 10 years in the Dallas, Texas area. That's where I really learned a lot, in particular, how much of an impact families can have in treatment outcomes, but I also learned how much help families need in navigating this whole treatment process. And I became so committed to wanting to help families that I ended up selling my treatment program, decided to turn my attention to working specifically with families. I wrote a book called RehabWorks, A Parent's Guide to Drug Treatment, and I developed a program for parents to go through while they have a loved one in treatment. And so then out of that book and that program, I spent a couple years developing an online platform just to sort of take the material in that book and deliver it in a much more comprehensive way. Now, my initial intention or vision for that online program that I was building out of RehabWorks was specifically to make this available for treatment centers. I taught myself how to make videos, online videos, and I narrated them, and I wrote scripts, and I took excerpts from my book, RehabWorks, and I packaged it all up into a pretty robust online program that I called RehabWorks. And I made it available so that treatment programs could make it part of their program and give access to families that they're working with. And here's one of the most key points that sounds trivial, it's overlooked, but it's almost one of the most important things, is that it made access to educational material to families immediately available at the time that their loved one admits to treatment. I'm going to come back to this throughout the day, how valuable and important it is for families to begin the treatment process as soon as possible, as opposed to having to wait for the first call from the family counselor, or the first family session, or the first weekend educational thing. That was the first thing that I did with RehabWorks, was to be able to make it available right away and provide information. And so RehabWorks, I'm going to talk a lot about RehabWorks today. And as I've been thinking about this, I is going to say this is not intended to be an infomercial for RehabWorks, but I'm going to talk a lot about it as an example of a solution. I want everybody to come up with solutions. If you don't have some of the things that's available through RehabWorks, whether you're a treatment provider or you're an individual family, you can get this material from me. It's available, but the bottom line is all my references to RehabWorks today are going to be as examples for solutions to overcoming some of the barriers. Thank you. Julie says it's a good book. You actually read my book. I don't pay attention to it's on Amazon. I have no idea if anybody buys that book or not, but I appreciate you saying that, Julie. So again, these are going to be examples. I'm going to refer to this a lot. RehabWorks, bottom line is I license it to treatment programs, and I also currently work with individual families, and we use that course, but I also do coaching with families where I help go through the course with them individually. Now, one of the premises behind RehabWorks, as I was sort of alluding to, another thing that I say these days when I'm sort of getting on the soapbox about improving family programming and treatment, I always want to take the high road and make sure that I don't want to sound like I'm being critical. There are many treatment programs that have excellent family programs. I will submit that despite, no matter how good the current family programs are, until we start checking families in along with the treatment clients so that they are there 24/7, until that happens, which I don't see that happening anytime soon, right? There will always be inherent gaps between the client, the family, and the treatment team, and those gaps are where important things fall through the cracks. And so what I'm talking about a lot today, it's not having intense family therapy sessions where we resolve deep-seated issues and unresolved issues from the family history and that type of thing. That's necessarily, obviously, all of this is important, but that might be what we think of as far as family therapy in drug treatment. As you can see, I don't know if you can see, how do I make this? These little statements I hear, things like, do they accept that they have a problem? When they say things, well, I can still smoke pot. I'll quit the hard stuff, but I can still smoke pot. Understanding relapse prevention or what the discharge plan is, it's those type of things that the family might not be completely understanding of what those mean. That's what I mean by gaps, because those kind of things, little cracks can turn into big cracks, and they can completely, it starts off with a power struggle, over, during visitations or phone calls, and the family might not, well, I'm not sure exactly what the counselor was telling him or her about that or not, but that's what I mean by there will be inherent gaps. And so, the first thing I was trying to do with RehabWorks is provide a solution for bridging that gap. There's no perfect solution, but as you'll see here today, I think by what I'm going to present as examples of this, you'll see what I mean by bridging the gap. And as you see in this slide, I sometimes refer to the family as the X factor in treatment outcomes. I have one slide someplace in some other presentation I do where I say it sounds a little harsh. I'll say the family can either make or break the case. A lot of treatment professionals are aware that sometimes families end up causing problems by enabling, not holding boundaries with their loved one while they're in treatment. And that can end up contributing to a poor treatment outcome. On the other hand, by learning the kind of stuff, as much as you can about how treatment works and learning how to support it, families can turn failed treatment experiences into successful treatment experiences. That's what I've been doing, working with families for the last 10 years. I can, give you lots of examples of that. And so let's see what we're going to do. What's my next slide here? We'll talk about clock management. We're already 17 minutes into this. I'm giving you my background in family support and treatment right now. We're going to take about 20 minutes to give examples of what I'm identifying as a framework for successful family support in treatment. And basically, I'm going to show you how my RehabWorks program is structured. I sort of recognize this in hindsight. I created 3 modules that the program consists of, and in hindsight, I realized, okay, the order of these modules works pretty well, and one builds on the next, and it becomes, as I say, a framework. And then the last couple minutes, I'm going to show you an example of how this framework ties together, and I refer to where it says from codependency to peace of mind. I'm going to show you an example of how these separate stages of this framework reinforce each other and help families move from the chaos and pain of an unaddressed problem all the way to getting to I use the term peace of mind, and you'll see when we get there, it's sort of synonymous with recovery. That's a sort of mysterious term that treatment professionals will throw at you. Well, make sure you work on your own recovery. It's important for you to work your recovery program too. So here's an example. Until you get in a 1, 2, 3 day family intensive, maybe the third week in treatment, or one treatment program the other day told me their family intensive is 45 days into their treatment. That might be when you really learn, if they take a little bit of time to explain what recovery means to you. But, in the meantime, you're sort of, a lot of unanswered questions is my experience. But I start using this term, peace of mind is a really good sort of interchangeable term for what it ultimately means when a family gets into recovery. I will probably, my goal is to get this out of here on the top of the hour, the next hour. I'll probably take a hard stop right there, to be able to, say goodbye to you for the purposes of the replay. When we get done here, I'll edit off, some of the beginning and the end, and I'll put this up for a replay. And I'll stay on here as long as anybody wants to, taking questions and answers. And then also feel free to type questions or comments into the chat as we're going along. I might not answer them right at the time, but know that I'll be looking at them. You'll know when I'm looking at them, because I get really distracted and I lose my place, and I'll have an awkward moment while I stop and read somebody's question. But do feel free to put questions or comments in there, and I'll try to work them into my presentation here. So we're going to start off looking at this framework. Three-part framework I'm going to present here that I have found to be very effective. And the first stage is simply education. I feel strongly about wanting to make sure, I think it only makes sense, that families should learn everything that the clients are learning in treatment. And so, for example, in RehabWorks, I talk about becoming, I use the term educated consumer. And by consumer, I'm meaning if we regard treatment as a product, it's a service that we're engaging to achieve an outcome, right? Lots of times in failed treatments, it might be fair to say that the right message was delivered, the tools were delivered, but in many cases, especially addiction treatment, there's a high percentage of lots of times the client is not interested in the message or the tools that are being delivered. In other words, they don't listen to the client. And sometimes that's true with the families as well, or again, because of the gaps, they don't get the message near as clear as the client does in treatment. And so I say I want families to become an educated consumer. By that, I say I want you to learn everything you possibly can about addiction, how it's treated, and what recovery looks like. So, say for instance, again, I'm going to sort of focus my comments to families right now. If you are a family member that has a loved one in treatment right now, couple of scenarios here. One, maybe your treatment program has good solutions to the things that I'm talking about here. They are able to get a good, comprehensive educational curriculum to you as soon as possible. Maybe that's happening. I think that there might be some folks in here that are families whose loved one is in one of the treatment programs that does use RehabWorks. And so on one hand, you are getting this. I told those folks that it would be valuable for them to come to this also, even though they're getting this information, to hear my commentary on, the bigger overall picture. What's the process here? And so the fact that you're getting these videos and are able to start as soon as possible, if you are using RehabWorks in a treatment program right now, you're hearing me saying, this is really valuable for you to begin going through this as soon as possible. Because a critical thing here is that lots of times the critical times in treatment that can make or break cases occur in that first week or 2 weeks, when you start getting the phone calls from the loved one saying, get me out of here. I'm not as bad as everybody else here. Or, the number of other things that can become potential power struggles or potential threats to leave treatment against staff advice. We want you to be prepared as soon as possible. And in some cases, lots of times, even when treatment programs deliver education, those families that are in here that are going through RehabWorks, now you know how much. There's a lot of information in here. And sometimes you might just get an hour or two a week on a Sunday afternoon if you go in for family education, or sometimes you wait for an intensive weekend once a month. And so again, one of the solutions here is to be able to get that information to families sooner rather than later, because it can put you in the position of knowing how to respond. And so again, Module 1 in RehabWorks is specifically all about substance use disorder, what it means to have a problem. First thing that needs to happen is we want to all be on the same page as far as understanding what the problem is that's even being treated. And so, again, if you have RehabWorks, if you're at a treatment program, this is why Module 1 is designed the way that it is. If you're at a treatment program that you might not be getting information right away, you can, here's my message to you today, a suggestion. Start on your own doing whatever you can to learn about what it means to be diagnosed with a substance use disorder, what the implications, what treatment looks like, how long it should last, those type of things, and what recovery looks like. You can get RehabWorks from me. You could start working with me. I can teach you all that stuff if you're not getting it from the treatment program. But here, what I'm going to show you, an example is, I said, tell families, I want you to become educated consumers. This slide here, if you can read it, it's pretty small print. I'll read some of these off. This comes from the review module that I made for RehabWorks. Once they go through the 3 modules, I set it up as a frequently asked questions section to say, this is going to point you back to material in the course where you can go back to when you find yourself in these situations. Families want to know how to respond if the loved one says, the very top one there, I'm not as bad as everybody else here, get me out of here. You want to know, what does that mean? Why? Well, if after you've gone through Module 1, you're going to understand that when they say they're not as bad as everybody else here, that probably means that they're comparing their drug of choice to other people's drug of choice. Maybe their drug of choice was pot or alcohol, and there's meth users and heroin users in there. And it's not uncommon for them to say, get me out of here, I'm not as bad as these other people. But when you are fully informed on what it means to have a substance use disorder, you'll understand that, the drug of choice is not really what it's about. And I teach, I say, you want to know how to respond, and I've got a list of responses for all these statements here. On that one, you say, when they say, I'm not as bad as everybody else here, your response just has to be, you need to be treated for your substance use disorder. That's all. Or you need to be in recovery from your substance use disorder. If you're not as bad as everyone, maybe it won't be as hard. And I'm saying that somewhat facetiously, but the point is, you say that doesn't remove. If you met the criteria to have a diagnosis for substance use disorder, you're going to understand that it needs to be treated, and there's a specific way of treated. And so these other, examples, I'll quit the hard stuff, but I can still smoke pot. I need to focus on my depression. That's a common one. There's a section in the first module, again, takes 2 minutes in a video, that completely helps families understand that if they've got a substance use disorder along with other mental health issues, you've got to arrest the primary issue, which is regarded, substance use disorder is regarded as a primary issue. You've got to arrest that before you can effectively make progress on other issues. It's only pot, it doesn't cause me any problems. When I designed that module, I went specifically at some of the most common areas of denial and misconceptions. And we all know that pot is one of the biggest power struggles. It's only pot, it doesn't cause me problems. You can't get addicted to it. Well, you know what? Yes, you can get addicted to it. But sometimes families get put in that position. If you haven't actually learned that specifically, you might not know exactly how to respond to that when they say that. But very simply, by taking a few minutes with the right education, you learn that and you don't get swayed. Pot doesn't cause me any problems. You know what? We've got a problem with your pot smoking, and if we got a problem with it, that's a problem for you because it's a problem in our relationship, and that is a problem. I can be around my friends and not smoke. I don't need to go to IOP. I'm fine now. I don't need any more treatment. I'm doing my steps. That's a nod to understanding what recovery looks like. What are these steps? It's appropriate for families to have a good understanding about what working a recovery program should look like. Or how to respond when they say, I don't like going to these AA meetings. AA is not for me. There's appropriate responses that avoid that becoming a problem area or a significant crack. My next slide here, again, I apologize. This is really small. It's more for the effect. I'll read these, but to show you this screenshot comes from survey responses when I've tested RehabWorks in treatment centers, and I have families write what was the most valuable part of this module that you got. And so I've got hundreds of responses from families, and I got a couple examples. I'll just read these real quick. After going through the first module about learning what substance use disorder is, and now picture that, if you have this within the first couple of days of treatment, the difference this can make in your support of your loved one. So these are just some random answers to what was most helpful for you in this particular topic. Explanation of how addiction is a brain disorder. Understanding about the importance that marijuana is not something they can continue to use. Hold them accountable that complete abstinence is required from everything, not just drug of choice. The importance of engagement in recovery activities to prevent relapse, the explanation of the differences between psychological addiction and physical dependence. This helped me understand the situation better. All of those, they're referring to specific videos in this module. And I'll just say this for your reference. Each of the videos in RehabWorks each module has about 10 to 12 videos in it, and each of the videos is like 5 minutes or less. And it's sort of, you have little fun quizzes that you have to take after it, and so you get into a nice little flow. Takes a family about an hour and a half to go through each of the 3 modules. But these are all things that the short little videos clarify and as you can see here, help clear up some misconceptions. I remember the first time I read this bottom one here, I was like, whoa. Somebody wrote, I thought rehab was simply detoxing from substances, had no idea it's a primary issue to deal with first. Have to treat it before progress can be made on other issues the person is dealing with. That's an example of, again, where families are when you're first addressing a substance use issue, and you go through the, maybe painful process of getting them into treatment, but then, there's a difference between sitting back and hoping that whatever it is that goes on in there is going to work, versus you being able to do a lot of things to help put yourself in the position to, ultimately, this is about supporting the treatment plan, supporting the treatment team. And so, again, that we're all on the same page. The second stage in this framework is starting then to look at the impact of substance use has on the family, giving tools for restoring balance, starting to look at the family's role in treatment. And I sort of sum this up with one word for convenience. The word boundaries is probably one of the most fundamental aspects of this part of it. It's about looking at what's happened in the family when a substance use issue is present. These are some slides that are from a video, one of the sort of the go-to videos in Module 2, that where the introduction to chemical dependency and codependency. I start off by saying the 8-second lecture on chemical dependency, just with the user there at the center and their chemical at the center of that circle. We say the 8-second lecture on chemical dependency is the substance user's life begins to revolve around the use of the substance. That's simple. Parents, or family members begin to nod. They say, yeah, that makes sense. And then we say, okay, 8-second lecture on codependency. There are other people in this person's life. 8-second lecture on codependency is their lives begin to revolve around the substance user's life, which is revolving around the use of the substance. What kind of day they have depends on what kind of day the substance user has, which depends on their relationship with the mood-altering substance at any given moment. They are, in a sense, codependent. Lots of family members start really nodding on that one. You sort of, ooh, yeah, that's right. We've been revolving. What kind of day I'm having? I see that it's affected or directed by what kind of day the substance user is having. And then we show that the first step towards family recovery, and this is the first step towards helping your loved one, is learning how to identify that dynamic and learn how to step away from that. That yellow line there that implies removing yourself from that codependent dynamic really becomes the most important thing for family members to learn about as you're in your support of your loved one's treatment. So the rest of that module, then I give tools for setting boundaries, dealing with resistance, and ultimately treatment accountability. Teaching part of that boundary for the family members is to learn how to make the client take responsibility for their treatment instead of us trying to talk them into, don't you think it would be a good idea to listen to the counselor? I teach the families, you know what? Just say, what's the counselor's recommendation? We're not here to control you. We're not here to tell you what to do. You're just going to say, what's the treatment team's recommendation? But you're learning this in the meantime, and you can feel confident and secure in setting your boundary about, we're going to follow the treatment team's recommendation, or we're going to stop trying to convince you to do it. Rather, we're going to have you tell us what the recovery plan is going to look like. Some of the things that families said in terms of from this module, I really understand how important family participation is. Setting boundaries and not being afraid to say that doesn't feel like recovery. I will apply these when she says it's just weed. To attend all the therapy sessions and be an active participant in her recovery. If you're a treatment provider listening to this, Wouldn't you love to have the family members saying that? I realize how important it is for me to attend everything that the treatment program offers. Lots of times, one of the biggest struggles with treatment providers is how do we get families more engaged? If you're on this call today, you do want to be engaged, but there's a lot of family members who don't want to be engaged. They still are in that place of thinking it's their problem and why should we have to bother with this? If we are able to at least conveniently get this information to, I think there's a number of people who maybe saw it differently, but after going through this, okay, now I see how important it is for me to be engaged. I really like the log we can use to document progress and identify if things are going well. Importance of setting boundaries, making the client take responsibility for their recovery, identifying defense mechanisms. Most helpful was the 2 examples of successful treatment and how they relate. The need for the family to be involved in capital letters, stop enabling. So there's all sorts of tools and worksheets in that module that has the families look at how they've enabled situations, how they've allowed situations to happen that even though they didn't feel good about it, how it compromises their own values. We have tools for dealing resistance and removing, we use the term wiggle room. And then towards the end of that module, I start having them equate this to their own recovery. And we have some tools in there about recognizing that them starting to take control of their own recovery is actually the best thing they can do in supporting the loved one's recovery. Then the final stage of this framework is measurement. And by that, I'm talking about helping the family understand how long the treatment process should take realistically, and how to make sure that a solid foundation for recovery is built. I'm a big fan of what's called the stages of change, and I teach the families the stages of change and have some very specific ways of using the stages of change. I give the stages of change for families to use as a tool to gauge where their loved one is in the process. And in particular, for example, I'll say that you can usually, in any case of relapse, you can usually go back through the stages of change and identify where a problem occurred, where there was a crack in the foundation. To give you an example, it's usually, as you see there, the contemplation or the preparation stage. The contemplation stage is where they're agreeing, do they have a problem or not? It's not uncommon for a lot of clients to go through 30 days of treatment and never admit that they have a problem, but insurance stops paying and, okay, I guess it didn't work, or, they send them off to IOP after inpatient treatment, but they still don't believe they have a problem. And one of the points that I make in one of my slides, I write in big red letters underneath where it says contemplation there on the right-hand side of that slide, I write the word motivation. Contemplation stage is the only place in this entire process where motivation occurs to move on to the next stage, which is the preparation, in other words, following the plan. And so what happens a lot of times is we get out of the primary phase of treatment and families get in a power struggle, and the clinicians get in power struggles with the client. Why aren't you going to your meetings? Why don't you think you should go to, why don't you, they said you should go to sober living, but they don't want to. And the reason they don't want to is if they're not motivated to follow a plan. If they don't believe they have a problem, or they don't really have a healthy respect, that's a better way to say this. It's easy to get them to say, yes, it's a problem. But do they really understand the implications, which all goes back to what families are learning in Module 1. If they understand all those things, they would be motivated to recognize, I've got to work a recovery plan. And the other thing about this stages of change is it gives a realistic perspective of how long this really takes. And as opposed to the common thing of treatment clients often think, couple weeks in treatment, I'm done, I'm fixed, I'm fine. And again, this stages of change is really valuable for helping families recognize, have a more realistic perspective. Some of the things that family members said here, what was the most helpful? The 3 pillars of recovery was really helpful. Now I understand what her recovery plan should look like. The 3 pillars of recovery, I put in there 3 main parts of a common treatment plan. The professional continuum of care. Why it's so important to go to, continued in a secondary phase, outpatient after residential, PHP or IOP. Why sober living is often recommended. Another pillar is the sober support, the peer support, which is different from professional support. And then the third leg of that stool is the relapse prevention, why it's so important to agree to a relapse prevention. Lots of times they don't agree to some of those things, and that we have very shaky foundations for recovery. Somebody else said the importance of setting a foundation, not skimping through the stages of change, and having a realistic perspective of how long the treatment process takes. Identifying red flags. Awareness of factors that lead to a shaky foundation. Discharge doesn't mean treatment's over. That's an important line that they get, the importance of IOP. I'm going to keep going here because I don't want to run out of time. That red flags part, it provides worksheets for the families to, and these, if you're a treatment provider and you're using this in your program, these worksheets upload directly to the staff, and you can get a lot of additional information that you wouldn't normally get. And so there can be things where the family might say, she says she's, committed to recovery, but she's got tickets to the rave, for the night she gets out of treatment, and she says she's going to be fine going to the rave where she used to spend all her time, doing drugs, and she thinks that probably wouldn't be a good advisable thing on a relapse prevention plan, but she might not be telling the staff about that. And families can bring that up, whoa, we need to talk about this, or we need to talk about that. Red flags, making sure we don't have cracks in the foundation before they discharge. That's the key. Lots of times we find out that there's cracks after they discharge. In a lot of cases, that ends up being too late. So we can see that the way these overlap, and I talked about how each one sort of reinforces the next, that first, the education empowers the family. Knowledge is power. We get everybody on the same page, takes the family out of the dark, and you can actually become a proactive participant in treatment. And then that leads into, okay, what are we going to apply our power to? Through learning about our role in supporting treatment, through the setting boundaries and recognizing the dynamics, and we're going to step out of that. The principle of that second stage is being able to take action, but the action is informed by the education. And then the third principle here is efficacy. By understanding what we were just talking about, the foundations, and they're not as far along in that stages of change as we thought we were. Just because the insurance company isn't authorizing treatment anymore, what happens lots of times is they get out of residential treatment, and we assume they're further along in the process than they really are. And that's where we end up with the power struggles. Instead of it being so important, if we recognize, okay, they can't stay in residential treatment forever, so yeah, they got to discharge and go to the next level of care, but it's so important for, the clinical teams to be communicating to each other, and if the family understands this also, they're still in the contemplation stage, or there's still some cracks in the preparation stage, we need to pick up treatment right where we left off in the previous level of care. That's what makes sense, right? Instead of, well, they made it through residential treatment, so they must be further along, and they're supposed to be going to their meetings, and they're supposed to be doing this, and they're not doing that, and we're going to just sit and power struggle with them. And lots of times, again, if it's matter of motivation. Families end up, like you're banging your head against the wall. But having a good understanding of all this is going to help you understand what a successful treatment really looks like. So the last thing that I'm going to share with you here is a way of putting this all together. And I'll refer back to, once I did a webinar in the opening, my opening statement, again, talking straight to families, I said, my goal for you by the end of this webinar is help you get to a place that I like to call peace of mind. And we talk a little bit about, that sounds like a pretty attractive thing for family members who are in the throes, the chaos of an unaddressed problem. You've been living with it for a couple of years. And getting to a place of peace of mind sounds very attractive. And then I'm able to even add the added positive feature of this is you can get to that peace of mind place regardless of what happens with your loved one. It doesn't have to be dependent on your loved one. And so let's take a look at this. I have this framework where we have two axes. And again, you probably can't read that. It says educated consumer on the left side. So that's the being informed, being educated about understanding substance use disorder, how treatment works, and what recovery looks like. And so the two ends of the axis here, down on the bottom it says uninformed, and up at the top it says informed. Then our second axis is going to be boundaries. And on the one end, the low end is the low end, and on the high end is the high end. Okay, it's going to range from low to high as far as in our ability to set effective boundaries. Okay, so by using these two axes, we're going to look at how this framework works. Somebody, let's say, who scores high on the boundaries scale, but low on the educated consumer scale, is possibly going to come across as being controlling. Let that one sink in for a second. Good at setting boundaries left and right, uninformed about why the boundaries are really being set. Not having a good understanding about what would be the appropriate boundary, they're going to come across as, I have words that I shouldn't say in public, as they're going to be a such and such. And controlling is a polite word to put that. Some of you can, put ones in the chat box or something if you relate, or comments if you see yourself in this thing here. But so, you're setting boundaries, but the thing is, you don't have a good informed base, and the people on the receiving end of the boundary, on some level, know that you don't have it. You're just being, mean by controlling by setting that boundary. On the other hand, let's say someone scores very high on the educated consumer scale. You're reading all the books and you're going to all the meetings and you're learning as much as you possibly can and listening to podcasts about recovery, but you have trouble setting boundaries. That person may possibly come across as feeling defeated. You know how things should be. You know how you want things to be, but man, we just never get there. And we can end up feeling defeated. And then if you have someone who scores low on boundaries and low on the educated consumer scale, that's where you might see the chaos of, for sure, the unaddressed problem, like how a family system probably is prior to intervention in getting someone to that place. And so again, if you got any comments to put in yourself, I always stop here when I'm working with families and say, where do you see yourself in here? And this can give a really valuable roadmap, a picture. They'll say, well, I see myself a little bit, I'm in the middle on the boundaries thing. I'm really low on the educated consumer stuff, or vice versa. And if you plot yourself on there, you can see what you need to work on. And again, there's information out there. If you have access to the information through your treatment program, treatment providers, my one message to you guys here is hopefully this gives you some insights, maybe some different thoughts that you can take back to your program, evaluate the effectiveness of the content that you are delivering, and helping families make progress towards this. Because ultimately, if you score high on both of these scales, that's where you're going to reach that peace of mind. And the beauty of this is you see how these reinforce each other. Being informed, understanding why, no, it's not a good idea for you to continue hanging out with your using friends. Or no, it's, not doing anything to support your recovery after getting out of treatment is not following staff recommendations. You're going to figure out a boundary. You being informed is going to help you inform your boundaries, and it takes some work on figuring out what the right boundaries is. I can't give specific answers to what you do in this case or this case. Those are kind of things that it's often helpful for you to get your own counseling to help you, hash through some of these things, the factors that go into what would be the appropriate boundary. But when you do land on being able to set a healthy, informed boundary, that gives you the confidence of knowing that you don't have to apologize for the boundary you're setting. You don't have to defend it. And then best of all, how they respond to that doesn't have to affect your peace of mind. Because you have done all this work in getting to the point of setting an informed boundary. And that ultimately, that is what recovery is. One of the things you'll hear, treatment programs talking about going to Al-Anon. Al-Anon is the format for they're teaching you how to identify that yellow line we looked at in that slide earlier and step out of reactive and being engaged in that dysfunctional dynamic. So let's sum up here what we covered. The framework, we start off, it's important to educate the families. And then we're going to shift that education into looking at their role in treatment and how to set healthy boundaries, how to restore family balance because it's gotten out of whack. Again, would take more time in these modules to help them understand what I mean by out of whack. But then that's going to, empower them to take action, become proactive in the treatment, an ally to the treatment team as opposed to somebody who's working against it by allowing the client to manipulate them. And then having a good understanding of treatment preparation. When it comes time to discharge, there might be some conversations about if they're really ready to go. Are there cracks in the foundation? So ultimately, this can dramatically increase the chances for treatment success. We talked about becoming an educated consumer. Here, I just went through all this. We talked about learning how to identify your role in this and stepping out of the dynamic. And we talked about using the stages of change as a way to measure treatment progress and get a really realistic perspective of the treatment process. We are coming up on the top of the hour. Here, I'm going to see if I can put a link. I've got a free guide that I give away called 5 Steps to Family Recovery. It's a short little PDF, and it basically is a good summary. Let's see what... I'm clicking on show. I'm trying to copy this link. I put it in the comments. I'm trying to put the link in the comments. here. If you go to jimsavage.net/family recovery guide, I'm sorry that I can't. Oh, here, I've got the, let's see. I'll put this link in the comment here. There we go. Like I say, that's a 5-page little quick PDF, but it covers both that codependency thing. It's got a little explanation of the circle and the stepping out of the dynamic, but it's got the stages of change in there, and it shows how families can actually use the stages of change to guide your own process. And so I am going to wrap this up. If you have any questions, please let me know. I'm going to, what do I got here? I'll tell you, resources from me. If you want to contact me, learn more about what I do work with families individually. I have a coaching program. You can use the RehabWorks through me. I do work with individuals, like provide aftercare services or do assessments and evaluations. But if you have a loved one and you feel like you could use some extra support, you can definitely schedule a free consult with me, and we can talk about if what I do might be something that could help you take control of your loved one's treatment now, or not just even now. You get out of treatment. Treatment doesn't last that long, relatively speaking, right? And there's still a lot to do after you get done. So that's something that I'm available for. I work with families individually. And if you're a treatment provider listening to this and you hear me talk about how valuable this can be for facilities, I'd love to have a conversation with you if you'd like to learn more about using RehabWorks at your facility. What else do I have? And that's what I was saying about RehabWorks. So I am going to close this out right now. I'm going to thank you so much for being here. And as I said, jimsavage.net is my website. You can find my email on there, or you can download that PDF that I just gave you. That'll get us connected. And feel free to reach out if you'd like to learn more about what I do, or if there's anything I can do to help. With that, I'm going to say goodbye. Thanks for joining us here today.